L-citrulline or arginine. Both are sold as nitric oxide boosters. Both promise better blood flow, a stronger pump, and better erections. But they are not interchangeable, and the better choice depends on what you are actually trying to improve. Today, we are separating the mechanism from the marketing, which one has better evidence for mild erectile dysfunction, which one makes more sense before training, what doses have actually been studied, and why neither one can manufacture sexual desire out of thin air. Welcome back to Pharma Shark. This video is educational, not medical advice. Erectile dysfunction can be an early sign of vascular disease, diabetes, medication side effects, hormonal problems, or psychological stress. A supplement should never replace a proper evaluation when the problem is persistent. We will answer two separate questions: what works better for erections and what works better in the gym. Here is the simplified pathway. Your body converts citrulline into arginine. Nitric oxide synthase then uses arginine to produce nitric oxide. Nitric oxide signals smooth muscle and blood vessels to relax. The vessels widen, blood flow increases, and that matters both for penile blood flow and for the muscle pump. So yes, both supplements can feed the same pathway. The important difference is how they get there. Swallowing arginine sounds like the direct route, but a meaningful portion is broken down in the intestine and liver before it reaches circulation. Citrulline bypasses much of that first-pass metabolism, reaches the kidneys, and is converted back into arginine. Human pharmacokinetic studies show that oral citrulline can raise plasma arginine more efficiently than the same oral route of arginine. That does not automatically make citrulline better for every outcome, but it explains why citrulline dominates modern pre-workout formulas. One correction matters here: nitric oxide is part of the erection machinery, but it is not the on switch for libido. Sexual arousal begins in the brain. Nerve signals then trigger nitric oxide release in penile tissue, smooth muscle relaxes, blood enters the erectile chambers, and venous outflow is restricted. If desire is absent, testosterone is low, anxiety is high, nerves are damaged, or vascular disease is significant, adding more substrate to the nitric oxide pathway may do very little. These amino acids can support blood flow, they do not create arousal type. For mild to moderate erectile dysfunction, arginine has the larger direct evidence base. A meta-analysis of 10 randomized trials involving 540 men found improvement compared with placebo or no treatment across studied doses of roughly 1.5 to 5 grams per day. The studies varied, and the effect was not a replacement for prescription treatment, but the signal was real. Citrulline is less directly studied for erections. A small pilot trial gave 1.5 grams per day to 24 men with mild erectile dysfunction for 1 month. Erection hardness improved in some participants, but this was a tiny study and cannot settle the question. The honest conclusion is simple: citrulline is biologically plausible and may help some men, but arginine currently has more direct clinical evidence for mild erectile dysfunction. If erectile problems are new, persistent, painful, associated with low libido, or happening alongside chest symptoms, high blood pressure, diabetes, or neurological symptoms, stop shopping for powders and get evaluated. A supplement can slightly improve one pathway. It cannot diagnose the reason that pathway is failing. For training, the answer flips. Citrulline is usually the more practical option because it raises circulating arginine reliably and tends to cause fewer gastrointestinal problems than a large bolus of arginine. But set your expectations correctly. This is not a stimulant, not instant strength, and not a steroid. The most defensible benefit is a small improvement in fatigue resistance and total repetitions during hard resistance training. A meta-analysis of 8 placebo-controlled studies found that 6 to 8 grams of citrulline malate taken around 40 to 60 minutes before training increased total repetitions by about 3 on average, roughly a 6% improvement. The effect was small and results varied between studies. That may matter when you are already training seriously. It will not rescue a bad program, poor sleep, or inadequate calories. Do not expect citrulline to add weight to the bar immediately, melt fat, or build muscle without progressive training. Research on strength, endurance, recovery, soreness, and blood pressure is mixed. Some studies report benefits, others find little or none. The pump is noticeable for some people, but a bigger pump is not the same thing as more muscle growth. For mild erectile dysfunction, studies of L-arginine commonly used a total daily dose between 1.5 and 5 grams, usually taken consistently, rather than as a one-time rescue. Speak with a clinician before combining it with prescription erection drugs or blood pressure medication. For training, a practical evidence-based range is 3 to 6 grams of pure L-citrulline or 6 to 8 grams of citrulline malate, around 40 to 60 minutes before exercise. Start lower if your stomach is sensitive. Read the label carefully. Citrulline malate is a blend, so 8 grams of powder does not necessarily mean 8 grams of citrulline. A product labeled 2 to 1 should theoretically provide 2 parts citrulline for 1 part malate, but supplement quality and labeling are not always perfect. If the ratio is missing, you do not know how much actual citrulline you are buying. A transparent label beats a flashy proprietary blend. Watermelon is a natural source of citrulline, especially in the white rind. That is nutritionally interesting, but concentration varies by variety and ripeness. Reaching a typical pre-workout dose from red flesh alone could require several kilograms of watermelon. Eat watermelon because you like watermelon. Do not turn dinner into a gastrointestinal endurance event just to chase a pump. Both supplements can cause stomach discomfort, nausea, diarrhea, headache, or lightheadedness, especially at larger doses. They may also lower blood pressure. Use extra caution if you take nitrates, PD-5 inhibitors such as sildenafil or tadalafil, antihypertensive medication, or if you have kidney cardiovascular or significant liver disease. More nitric oxide support is not automatically safer. Here is the clean answer. For mild erectile dysfunction, arginine has more direct clinical evidence, but the expected benefit is modest and it does not replace diagnosis or proper treatment. For resistance training and pump, citrulline is usually the better choice because of its oral pharmacokinetics and small potential benefit for fatigue resistance. For either goal, buy a clearly labeled product, use a studied dose, and stop expecting a supplement to compensate for bad sleep, poor cardiovascular health, or a medical problem. Which one have you actually tried? Arginine, pure L-citrulline, or citrulline malate? Comment with the dose and what you genuinely noticed: pump endurance, erection quality, stomach problems, or absolutely nothing. If you want men's health and performance explained without supplement store mythology, subscribe to Pharma Shark. Understand the mechanism, respect the evidence, and use the right tool for the right job.